Hi everyone, in today's lecture we're going to be talking about birth. So first I wanted to just mention a little bit about the hormone called oxytocin. So this is something that is going to kind of be the first steps in triggering labor, as well as helping to form an attachment between mother and baby. And so oxytocin is often called the love hormone. And so this is something that occurs as labor begins, as well as after birth during lactation. This hormone is released, and we do see that labor begins when the amniotic sac, or the fluid that protects the fetus, does break. So again, kind of thinking about water breaking, as I mentioned in our previous lecture. Sometimes this happens all on its own, sometimes this happens with some help, and we do see that most firstborn babies have a 12-hour labor period. And there are many different birthing positions and variations depending on culture and personal preference. So it could be that you prefer sitting, squatting, lying down, or water births. This could also be due to necessary medical supports that you need. So if you were to have a birth that requires you to have a C-section, the position in which you're giving birth would be very different than if you were having a natural birth all on your own. And it also depends on whether or not you're having a home birth or you're having a birth within a hospital. And we'll talk a little bit more about those in the next few slides. So newborns within the first few minutes of life are going to cry spontaneously. Their color is going to change from bluish to pinkish. Their eyes, fingers, and toes are going to start to open and close. So those initial reflexes that we see of newborns. We also see that an APGAR scale is used, so you can look on the next slide to kind of see what the APGAR scoring system looks like. So this is looking at activity, pulse, grimace, appearance, and respiration of the newborn baby. And so this is looking at all different kinds of things to assess the newborn's heart rate, their breathing, their muscle tone, their color, and their reflexes. And this is completed twice, so in the first minute as well as the first 5 minutes after birth. And a newborn can receive a score of 0, 1, or 2 in each category. And the desired score is of a 7 or above. So again, make sure that you check on the next slide to kind of see what that looks like. So for example, if we're looking at A for activity, this is, do we see the muscle tone? Do we see flex limbs? Do we see that there is movement within the arms, the legs, the fingers, and the toes? If we were going to be looking at appearance, for example, so the skin color, do we see that there is a pinkish flesh skin tone? For example, my cousin, she actually fell into the amniotic fluid when she was born because there was a lot of pressure during the birthing process, and so kind of where the amniotic sac fluid is caught at the end of the bed, she kind of shot out into there, and so her original scores on the APGAR scale of appearance, or the second A, were of 0 points at first. She was starting to kind of turn blue or pale due to having sucked up some of that amniotic fluid. So again, we're looking at all different indicators on the health of the baby, and so that's why it's important to check at 1 minute and 5 minutes after birth, just in case there's any complications or rapid changes. Now, of course, we should be checking to make sure and monitor the baby beyond just that 5 minutes, but this is typically when that APGAR scale is going to be used. On this slide, I just have a little bit of information about newborn reflexes. We're going to get into newborn reflexes in a lot more detail with our infant and toddler lectures. This is just to kind of help us to set up and know what the purpose of these reflexes are. So maintaining oxygen, maintaining constant body temperature, and managing feeding are primarily what we're going to be seeing as soon as a newborn comes onto Earth. And so we see that initial first breath is going to support maintaining oxygen. So keep in mind that that APGAR scoring system is going to help us to recognize if these reflexes are present. If they're not present, how do we better support? So if breathing is not occurring right away, how do we get levels of oxygen management to be able to be supported on their own, as well as constant body temperatures. So crying, shivering, tucking legs to body, and pushing. Those are common reflexes that we're going to see to help maintain body temperature. And then with feeding, we see sucking, rooting, and swallowing. And so we're going to get into all of those aspects of managing feeding, specifically rooting, in the next lecture. So stay tuned for that. On this slide, you'll just see some information that indicates how large, or how small, I should say, a newborn with a low birth weight looks like. And so we'll see that low birth weight is going to be typically about 5.5 pounds. Very low birth weight is going to be 3 pounds and 5 ounces. Again, these are rough estimates. Extremely low birth weight is going to be 2 pounds and 3 ounces. We also see that we have preterm newborns, and this is 35 weeks or fewer after conception. So a typical newborn is going to be at 40 weeks. And so you could have a low birth weight and be at 40 weeks. You don't have to be preterm to have a low birth weight. However, we do see that more preterm babies are going to experience a low birth weight. And we also might see that there are babies who are going to be small for their gestational age. And so that is just also considering at 40 weeks, they may be smaller than a baby at 40 weeks with a typical birth weight. And this also could depend on environmental factors, genetics. So there are different things that may impact the birth weight of a baby. We do also see that some individuals need more medical assistance. Now, this does depend on whether or not you choose to have a birth within a hospital where there is medical equipment available to you, or if you are doing a home birth, if you have access to medical assistance. And so this does depend on the kind of childbirth and what is happening. So again, if you have preferred customs in which you choose to not have any medical assistance, this might not apply to you. And so these are things that are often discussed ahead of time with the parents, as well as determined by the position and size of the fetus. So for example, if there are complications in where the positioning of the fetus is, this may require a conversation and discussion on medical assistance. And so oftentimes this may be a result of the fetus being in a position that is not prepared for a vaginal birth. We also might see that the umbilical cord could be wrapped around the fetus's neck, and so then baby would not be able to come out all on their own, and so we may have to move from a traditional vaginal birth to a cesarean C-section. And so this is a surgery that involves cutting open the woman's body to have the baby. And so this is something that could be planned, or it could be unplanned in an emergency. Typically, if you've already had a C-section, then you will plan to have another one, just because there is more likelihood that you could rupture or open up the scarring in that area where the C-section was the first time. We also see that in most developed nations, childbirth does include sterile procedures, electric monitoring. There are some drugs, such as an epidural, that kind of help to get you ready to go and help the body loosen up for the birthing process. Again, this could be something that you choose to opt out of depending on your own customs and your cultural preferences. Not everybody wants to have certain drugs to speed up contractions as well as to support pain management. So it does depend on what you prefer during the time frame of your birth. So home births are pretty self-explanatory, but I did just want to provide a little bit of information here. So we do see that majority of home births that are planned happen in more developed countries, because there is better access to any kind of medical assistance if needed, as well as there are more procedures and individuals who can be within the home to support during that birthing process. And so you might have a doula, which is somebody who can come and help you during that process with breathing and other areas of support. We do also see that there are more procedures that you can have set in place ahead of time to know how to safely have a home birth. But we do see in more poorer nations that almost all babies are born at home. There's just not the same kind of medical assistance and access that we would have in developed nations. We do see that there are potential risks for the baby within a home birth. So again, if there were complications dependent on the position and size of the fetus, also if we have complications with the mother during the birthing process, there may or may not be the same accessibility to medical support if we are having a home birth. And so there is a higher risk for the mother during the time of the birth in a home birthing area. We also see that it's important to be medically informed prior to, if you're able to plan out a birth at home, just having the information that you would need so that you can have an informed decision is always the best option. But again, this is something that differs between mothers, and so it's a personal and cultural preference. Last but not least, just a little bit of information on family bonding. We're going to get into the significance of attachments later on in some of our lectures, but just to kind of wrap up, when the birth happens, again, we have that release of our hormone of oxytocin that kind of jumpstarts the key elements of that strong, loving connection. And so this is when that initial bond begins to form. This happens during skin-to-skin contact. This happens during feeding. This happens when you're responding to those initial reflexes, such as when the newborn is starting to cry or starting to kick their legs or starting to suck and looking for feeding to happen. We see that it's not essential for human bonding, but it is important that skin-to-skin contact happens if you're able to, because it can increase the likelihood of a strong connection between yourself and your child. And we also see that creating secure attachments are essential for the health and well-being of a newborn baby. And so I did include a video here that supports that. And so it just goes into a little bit more detail on the theory of attachment and kind of what attachment means. So when we're thinking about attachment, we want to consider that this is when we are responding and recognizing when there are different cues from our newborn. This is when we're considering basic needs of caregiving. This is when we're thinking about our tone of voice. Again, our responses to their behaviors, our ability to check in with them and recognize when their needs have not been met. So basic needs are extremely important during those initial connections of attachment. This is also when those beginning stages of trust are forming. So does my infant trust me during this time period? And like I said, we'll talk about this more in detail when we get into our infant and toddler lectures. But for now, this is just a little bit of information kind of tapping into some different elements of birth. So talk to you in the next lecture, everyone. Bye.